No presidential candidate will dare discuss this issue, yet it is central to solving the healthcare debate. More people have died from heart disease in the last 10 years collectively than the total sum of all the combat deaths in the history of all wars that have ever been fought in the United States since 1785. In fact, of cardiac arrests that occur each year in US hospitals, only 24% of those patients survive. According to the Insurance Institute for Highway Safety, there were 37,133 deaths from motor vehicle crashes in 2017. According to Federal Violence Against Women Act, more than 1,800 women were murdered by men in 2016. In addition, the total worldwide American deaths from terrorist attacks from 1995 to 2016 was 3,658. So let's run the numbers. The combined deaths for car accidents in 2017, plus the total women murdered in 2016, plus the total American deaths from terrorist attacks from 1995 to 2016 equals 42,591 total deaths. A shocking 18 times more people died in 2011 from heart disease, 787,000. In fact, the combined deaths for car accidents, plus the total women murdered in 2016, plus the total American deaths from terrorist attacks collectively, let's also include all the combat deaths from the history of all American wars to that number, and you would still have more people who died in 2011 from heart disease. To match the number of deaths from heart disease in 2011, we would also need to kill the entire population of Vatican City, the population of the country of Monaco, the entire population of St. Augustine, Florida, and we would still need to go up to Walla Walla, Washington and kill all 32,148 of their residents. And even then, we would need to find 2,800 more people to kill in order to have more people than who died of heart disease in 2011. There are over 18,000 federal, state and local law enforcement agencies around the United States. Plus, there are a total of 2.1 million active-duty military and reserve forces as of September 2017, according to US Defense Department personnel data. When you add the total US military to the total law enforcement officers, you get a defense force of approximately 2.85 million personnel. That is an impressive defense force. Yet, where is our prevention health army of highly trained personnel? Folks, we have only mentioned heart disease. When you add in all the other obesity-related diseases, the numbers are off the charts. Yet, when it comes to the US healthcare debate, what you hear and will continue to hear are the same old talking points from all sides, primarily focused on reacting to diseases. They seem to be more centrally focused on how much money will be there to pay for medicines and chronic illness, rather than on prevention. It is time to shift the problem solvers from politicians to doctors and scientists, and from reaction to prevention. It's time to have a tough conversation about preventative health. There are 1.1 million doctors and 3.9 million nurses in the United States. These medical professionals are highly regulated in the US. In order to become a nurse or medical doctor, you must study for many years, pass a national exam, and are continuously regulated by the federal government, and with severe legal consequence if these regulated protocol and best practices are not followed for each medical professional. Therefore, we heavily regulate, essentially, reaction. However, prevention is not regulated in any meaningful way. In fact, most personal trainers have very little training. You can get a personal training degree in less than just a few months in most states across the United States, and any celebrity who has lost a few pounds can peddle their next weight loss gimmick. It's sort of fascinating that so many celebrities just lose a few pounds and then shortly after have a new book or program on the market. This is so preposterous. Just because you had surgery does not mean you are now qualified to perform surgery on someone else. It's time to stop this madness. It does not make sense to regulate reaction but not prevention. There is too much to lose, and financially, it's simply unsustainable to stay on this path of destruction. This is why, here at University for Weight Loss Science, we have recruited over 3,000 medical doctors, scientists, and medical professionals to help to change this trajectory. It is time to put medical and science professionals in charge of prevention, rather than a bunch of celebrities, poorly trained fitness industry professionals, many with dark ages solutions. Rather than being on a weight loss journey year after year, it's time to learn weight loss fitness science. Achieve your results. Learn how to keep your results. And then focus on having new experiences each year because you're already fit and healthy. This is Joy, reporting for University for Weight Loss Science. Leave a comment and please click the subscribe button below to watch more amazing videos.